Well, good morning. Good morning. It is 9:05 and we are going to get started today. My name is Bailey Tennyson and I am the Kansas City RPDC compliance consultant. With me today, I have my dear friend and colleague, Lisa Day, who is the special education compliance consultant from the South Central RPDC. And today we're really going to hit on just the beginning of the year special education hot topics. So in the chat, please type the number on how you're feeling today. What kind of cat are you? And if you want to give us an explanation on why you're that number, feel free to. And if not, that's okay too. So let us know, how are you feeling today? I got a lot of sixes already. Sevens. 9, I like the 9. A 10, there is no 10. 3, overwhelmed. Trying to maintain a positive attitude. Number 3, sped track is up to date. 1 through 9, Janet, depending on the moment. I believe that, honey. Scott, I'm sorry you hate cats. It was between cats and llamas, and I didn't know which one to go with. I figured more people had cats than llamas. Next time I gotcha. Llamas, okay. Christine, llamas next time, don't worry. Well, it's good to see how everyone's feeling. I'm not gonna lie, today I'm a 6 because I'm so excited to be here working with you guys. It's amazing seeing we have over 257 participants right now, so that's just awesome. Thank you guys for being here. A couple quick hits that I want to make sure everybody understands and knows is that the same Zoom link will be used every time. So I did have some people ask me about that. So I did want to make sure that you understand that the same Zoom link will be used every single time so that you should be able to go from there. There we go. So here's some Zoom norms that we have for today. Please be muted. This really helps us in making sure that things just don't get interrupted. We are recording this training so that way you can utilize it with your staff. So if you are muted, that would be greatly appreciated. We ask that you use the chat to ask questions. Be mindful that when you do ask questions about specific situations, please do not provide any personally identifiable information. Remember that all questions in the chat are going to be gathered, and then we are going to put together a question and answer document that's going to be posted later on in those virtual resource support meeting, the DESE webpage that we have for that. So please make sure that if you do have a question, we ask that you do not unmute yourself and ask to the whole group. We ask that you really do just put that into the chat so that way we can collect those and create that really great document for everyone. So our objectives for today is we're going to first hit on the state plan updates. We will look at the local compliance plan, and we're going to do some reminders with you guys on that. We will talk about the special education form updates. And then Lisa's going to take you into some special education hot topics. She's going to look at transfers, seclusion and restraint, IEP implementation. And last but not least, we want to make sure that we use this time to also discuss some of the resources that we have available to you, which would be the to-do lists or the myth of the months, and then also these amazing virtual special education resources that we are putting out from last year and this year. So before we get started, I want to make sure everybody takes a big deep breath. The last couple of days, I've been bombarded with questions regarding state plan changes and form plan changes. So please just take a deep breath. Understand that any of the changes that we are making for the good of the cause. We are trying to improve. We're trying to align ourselves more with the federal regulations. So we want to make sure that those state plan changes really do help continue our growth as a state. So let's get started. The first update that we're going to talk about today is in regards to other health impairment requirements or qualifications. So you will notice on page 27, we added 2 additional titles to the list of qualified personnel who can evaluate and identify a health impairment. So the reason that we did this, the reason for this change is that physician assistants and advanced practice registered nurses are authorized to evaluate and treat patients, including prescribing medications and under the direct supervision of a licensed medical doctor. So accepting diagnostic reports from physician assistants and nurse practitioners will actually make it easier for parents and school staff to get access to medical personnel qualified to evaluate our children. So this is a wonderful thing. We added that licensed assistant physician, and Missouri State Board of Nursing recognized advanced practice registered nurses as well. So this is just one great change that we have made. Our next change in the state plan comes from page 52, and this change deals with ensuring parent participation at IEP meetings. DESE has now included video conferences as an alternate means for parents to participate. This change is also consistent with IDEA, which is a wonderful thing. So once again, we are trying to kind of update our forms of being able for parents to participate, and Zoom meetings are part of that video conferencing now. And so hopefully that should be able to help you. Google Meet as well. So hopefully this is just one more great change that we have made to make school districts' lives a little bit easier in getting parent participation. We noticed that during COVID era, we actually had an increase with some school districts with parent participation once we allowed Zooms to happen with parents. Our next change that we were going to discuss is on page 54 of the Missouri State Plan, which deals with in-state transfers. During the time of a reevaluation, when it's being conducted, the agency should implement the IEP as written from a sending agency and provide comparable services until the reevaluation is complete. We took out that school districts need to develop an interim IEP, which is once again consistent with IDEA. So we struck out develop an IEP, and instead we added provide comparable services. When looking at page 66, this discusses parental consent for reevaluations. In this section, it discusses how the LEA must obtain informed parental consent prior to conducting any reevaluation of a student with a disability. And if the parent refuses to consent to the reevaluation, the public agency may but not required to pursue the reevaluation by using the consent override procedures such as mediation or due process. The public agency does not violate its obligation under child find or evaluation if it declines to pursue the evaluation or reevaluation. But after this portion, DESE compliance added a sentence describing an exception to the consent requirement to make this section consistent with IDEA regulations. So we added this sentence: informed parental consent need not be obtained if the public agency can demonstrate it made reasonable efforts to obtain such consent and the child's parent failed to respond. I want to make sure that you guys understand it's failed to respond. It's not refuse, okay? Because those are 2 different actions. So if a parent fails to respond, you send it out multiple times and you get no response from the parent, then you can go forward. I hope everybody knows by now, speech implementer is no longer a thing. We have been warning you guys about this for a very, very long time. So speech implementer is no longer happening. So therefore, regulation 8, we took out, completely deleted that section from the state plan, because in 22-23 school year, this is no longer in effect that we can use speech implementers. And the last portion of the state plan that needed to be updated was in the MSSD section. In MSSD referral section in the state plan, we revised this section to make it clear that the local public agency is responsible for determining placement in the least restrictive environment. This also includes when MSSD is no longer the appropriate placement. So once again, this is on the local agency, the school district, to determine fate. We also decided to remove reasons why MSSD would no longer be able to provide FAPE in the least restrictive environment, because IEP teams really should be making that decision on determining when the least restrictive environment is no longer being implemented within MSSD. So these two examples are not the only two possible reasons why a school district may need to change the least restrictive environment. And then last but not least, when MSSD is no longer the appropriate placement, the public agency should convene the IEP team to change the placement in the least restrictive environment. We also removed the reference to the transfer student process because once again, the local agency is responsible for determining placement when the student attends MSSD and continues to be responsible when placement in the least restrictive environment changes. So federal regulations implementing Part B of the Individuals with Disabilities Act, or IDEA, require responsible public agencies providing for the education of children with disabilities within their jurisdiction to have effective policies, procedures, and programs that are consistent with state policies established under applicable federal regulations. At this time, the Office of Special Education has published an updated model local plan for compliance, which is consistent with the provisions in the Missouri State Plan for Special Education, which has became effective since June 30th of 2022. That means that all school districts need to now either adopt or adapt their local compliance plan. Excuse me. Remember that public agencies must adopt or adapt this plan by October 1st, 2022. This means that you will want to make sure that your local compliance plan is a part of your agenda for that September school board meeting, because you're going to need to get signatures from the school board president, the superintendent, and then the person that is going to act as the compliance person within your school district. So step number one is your agency must choose one of these following options for your local compliance plan. So you have three different options that DESE has put forth. The first option is that you just adopt the model plan that DESE has provided. The second one is that you can adapt that model plan, but I think it's important that you know that any revisions that you change have to be approved by DESE before the agency's compliance plan becomes final. Or the last option, option C, is that you write your own compliance plan. And then once again, that compliance plan needs to have approval by DESE. So once you have determined if your district is going to choose A, B, or C, the next step is that you're going to go to your board and you are going to present that to your board and get approval. I did want to make sure that you guys, once again, I don't know if I said this PowerPoint presentation will be available on the DESE website. So we wanted to make sure that you do have access to that link of where you can find your local compliance plan. And this link gives you those instructions on how to fill it out and also view the model Missouri local compliance plan. So the last step in this is that once you've figured out what you're going to do, you've presented it to the board, you're going to submit your policy and your documentation to DESE. And we have put on here the information as to who you're going to submit it to. You would submit it to DESE, attention of Ashley Butchmiller, P.O. Box 480, Jefferson City, Missouri, 65102. So you're just going to send that off to them. And this is what that certification statement looks like. So this is what you will be sending off. Once again, I have to reiterate this. This needs to be signed by your school board president, your superintendent, and then the compliance plan contact person. Most likely that will be the special education director. And so for a lot of you guys, this is something that needs to be added to your school board minutes for September. So please try and get that added to it so you can make sure that it is sent off by October 1st.
Bailey,
Yeah.
somebody asked if it could be emailed to them. It used to be allowed to. It's not stating that on the form.
Yes, and once we're going to compile those questions and we will answer that in the chat or answer that in that Q&A. Thank you, Lindsay. The last big updates that I'd like to speak with you all on is our new and improved special education forms. So there were not too many big changes. I want to make sure I reiterate this, but the first change is in the review of existing data form. So we have now split up the health and motor sections into two. So it used to be on the red that you had health and motor together in one box. Now they've been split apart because health and motor are two separate things. And we really wanted to make sure that we were gathering good information and data regarding both sections. The next change that we made was we removed the term central auditory processing from the hearing section, and we moved it to the language section. And the reasoning behind this is that central auditory processing is a neurological activity that underlies processing and consists of the mechanisms that preserve, refine, analyze, modify, organize, and interpret information from the auditory periphery. So it's not just hearing something. So we wanted to make sure that in the right section, which would be the language section. And then the next change is in the event that the team determines that they have sufficient evidence to continue eligibility without assessment, we determine we're going to do a red without assessment. DESE has included a section asking for the team to provide data to support this decision, since the form really will then replace that evaluation form. So we've kind of added some sentence starters for you guys to make sure that you provide all that good data to support that the students continues to meet eligibility. And then the last change was just a formatting change that we did, and it's on page 6. And basically we just changed things from vertical to horizontal. And I'm gonna see if I can, let me see if I can find it. Sorry, I got lots of screens open, so bear with me a minute. Okay. I'm going to share with you guys the red form just so you can see it. So here's what the review of existing data looks like now. You will notice that we split up those two sections like I discussed. We moved central auditory processing to right here. And then if you scroll down, we've now added these wonderful sentence starters for you. So that way you have all that good information to determine that the student still continues to meet eligibility. And then once again, on this page, we just changed it from vertical to horizontal, just to make it more user-friendly. The next form I want to discuss with you is the notice of meeting form. I'll share that one with you as I talk. I believe this is the right one. There we go. That we've added in activity is suspected. The nuances behind the numbers of attending the meeting, in person and virtually. So we're trying to stress that LEAs, that there is a difference between the individual who can interpret the assessment results and an individual who is qualified to conduct the assessments. So we really are trying to make sure that the people that are doing these assessments really truly understand what their assessment results mean. The next form that I want to talk with you guys about is the evaluation report. I do not think I have anything. Yeah, I'm not going to show you guys the evaluation report, so we can share with you the slide again. Give me 1 second. There we go. In the evaluation report, we changed the title from case history to background information. We changed hearing, health, motor, and language sections to align with the red. And then under the team conclusions and decisions, we added the individual sections that the report should cover. And then last but not least, we just wanted to clarify what we're looking for with basis for determination. So we added some good stuff in here to really assist you guys with what we are looking for when we are determining eligibility. In the discipline documentation form, we had a typo, so we fixed the typo. For some reason, we had the word alcohol instead of weapon. So we had drugs, alcohol, and serious bodily injury, and it should be drugs, weapons, and serious bodily injury. How it got away from us, I don't know, but we got it fixed. In the out-of-state transfer form, there was just an error on page 4. So we corrected it whenever, excuse me, for a decision when we reject, an initial evaluation must be initiated to determine eligibility. So this was for the out-of-state transfer, and we said reevaluation, but it should have been initial evaluation. So once again, it was an error that we wanted to fix. And then last but not least, we made some changes to the IEP. The last changes that we made were on the annual IEP goals page. And basically what we did was we added right here a description of progress supported selected by the summary statement. It's not enough just to check one of these boxes. We need to have a description and data as to either how that child has made progress or what's going on and why the child's not making progress. We need to have that good, rich data. And so we wanted to add this section to assist us in that. We also made sure that we had different sections for the dates as well. And I'm going to pass it off to Lisa, who's going to talk about special education hot topics.
Thanks, Bailey. You've done an awesome job so far. So the first topic that we want to discuss is transfer. And so Bailey, if you want to advance the slide, thank you. So those are always front and center at this time of year. I bet some of you are sitting at a desk right now where you have a stack of transfer documents there and you're thinking, what am I going to do with some of these? So we're just going to do some reminders about how to handle transfers. Okay, so because it's one of the first activities that occur at the beginning of the year, we're going to go through the compliance requirements a little bit more in depth so that you can ensure that timely and seamless transfer from one school district to another so that the student doesn't have that disruption in their services. So once you get a new student in your district, you need to make sure that you look and listen for any indications that that enrolling student might have been identified previously as a student with a disability. And the first place to determine that is the initial contact that that parent has with the school district through the enrollment paperwork. It's important to know who in your district is responsible for this initial contact. So in some districts, it's the building secretary or the school counselor. In other districts, it's the principal or the registrar. So no matter who it is, they should be trained to look and listen for those buzzwords or those words that parents use to indicate that that student might have had an IEP in a previous district. Because a lot of times parents don't just come in and say right out, my student had an IEP in the last district. They use other sort of words to indicate that. Make sure that staff knows it's okay to ask questions, clarifying questions to get the right information. And the bottom line is you just need to have that process in place that identifies who those students are that transfer in with IEP so that they continue to receive their services from day one without that disruption in services. Okay, so in Missouri, the Safe Schools Act requires that receiving school districts request student records within 2 days of enrollment. Sending Missouri school districts are required to send records within 5 business days of receiving the request. And also remember that FERPA allows for that exchange between LEAs. You don't have to get written permission from a parent to request their students' records from another district. Also, this is really important. The receiving school cannot keep a student out of school pending the receipt of school records. In other words, you have to allow them to go ahead and attend school. You can't say that because I'm waiting on your records, you can't start school. And another way to gain information is the interview process. So make sure that your interviews are conducted in person or over the phone. They should be conducted with the kiddos' parents, with the previous school staff in the other district, like maybe the special education teacher or the counselor or whoever has information about that student. And it just gives you a better picture of the types and amounts of services that a student received in the previous district. A lot of times you look at those enrollment documents or the transfer IEP and evaluation, and it isn't really clear just exactly what the student was receiving, but that interview will clear up a lot of that. Okay, so in the state transfer or the in-state transfer requirements are found in the 500s, and the compliance requirements for out-of-state transfers is in the 550s. And then there's also model transfer documentation forms that we've provided, and we give you links to that later on the slide so that you can find those easily. Sometimes kiddos come to districts and they've got that full set of documents. They have a folder they lay on your desk, and it's just a beautifully organized folder, but that's not always the case. Sometimes they show up with just a little bit of paperwork. They might have a page from the IEP. So once you get the information, just follow the prompts on the forms. They really do tell you what to do. They walk you through the standards and indicators, and they walk you through the process. One of the biggest difference in the transfer process is what happens when it's an in-state versus an out-of-state transfer. So you can accept a transfer evaluation report if you believe it's compliant and includes all the information necessary to determine eligibility in the state of Missouri. So that's key. They have to meet Missouri eligibility criteria. If you do not accept the transfer evaluation and it's an in-state transfer, you go through the re-eval process. If it's an out-of-state transfer, it goes through the initial eval process. And again, if there's an IEP, IDEA makes it clear that FAPE has to be provided, and there can't be any delay in providing those special education related services. They can be, you can accept the previous school's IEP, you can develop a new annual IEP, or you can provide comparable services based on that interview and that agreement that you have with the parent. But remember, there's no amending a transfer IEP. You either accept the IEP as it is and implement it exactly as it is written, or you reject it and then you develop a new IEP. Also, one other thing to remember is if you are conducting a reevaluation, you just provide those comparable services until that annual IEP can be developed based on your new evaluation information. Okay, so here's some quick tips for keeping the transfer process as smooth as possible. First of all, just remember the person reviewing the evaluations has to know and understand Missouri eligibility criteria when they're making decisions. So pull out that standards and indicators and really use them to go through that eval. Use the forms. They guide you through the process step by step. They will really reduce your stress level when you're trying to make decisions about what to do. And also sometimes we get a little overwhelmed at the beginning of the school year, and we're tempted to could skip those interviews to save time. Do not do that. You must conduct those interviews, and the best information comes from those interviews. Finally, keep detailed documentation of your consultation with the parent regarding the comparable service while the new IEP is being developed, and make sure that the parent understands exactly what and how much you'll be providing, and that will avoid big misunderstandings later. Okay, and then as I mentioned before, these are just links to our flow charts for in and out of state transfers, and then our forms, so that you have them right here at your fingertips and you're not hunting around on the DESE website for them. Okay, and finally, before we leave the transfer topic, let's go over some really common transfer myths, things that as compliance consultants, we get quite a few questions about these every year. So first myth is out-of-state transfers do not need to meet Missouri eligibility criteria. And the fact is that the transfer report has to meet all the requirements. It can't just meet partially or mostly, it has to meet all of the requirements. And then another myth or another question that we get quite a bit is we have to accept and implement all evaluation reports and IEPs from Missouri LEAs, and that's false. It still has to be compliant with Missouri standards and indicators in order to accept. If one or both are not compliant, just follow the prompts on the state forms and it will tell you what the next steps are. Okay. Another common myth is that transfer IEPs can be amended, and we've already mentioned this several times. The fact that you can't amend transfer IEPs, you just have to implement it exactly as it's written, or you provide comparable services until you can develop that new IEP. Another myth is if a transfer student requires an eval, an interim IEP is written. And again, Bailey touched on the changes in the state plan that really made that very clear. There's no such thing as an interim IEP. You just provide comparable services while you're conducting the evaluation. And then once the evaluation is complete, if the student qualifies, you develop a new IEP. And if the student doesn't qualify, you just provide the parents with a prior written notice that indicates the student isn't eligible. Okay. Last myth that we want to discuss: if we receive the evaluation report and IEP, we don't need to write a new IEP until annual review time. So the fact is, if you implement it exactly as written, you can wait until the next annual review. However, if you can't implement it exactly as written, you provide comparable services, develop that new IEP, and typically the expectation is that new IEP is in place within 30 days of enrollment. And the last myth is that comparable services are decided solely by the IEA, and that is a big fat false. You need to consult the parent to determine what services are comparable to those in the transfer IEP. And remember, as I mentioned before, you need to keep really detailed notes about this conversation and the decisions that were made. This will just save you a lot of heartache later. So also, we put a link to the August 2021 Myth of the Month. It discusses in detail the transfer process. Okay, so now let's move on to seclusion and restraint. And I hope everybody takes a big cleansing breath and lets it out in a big exhale, because we've had a lot of questions about this. And I really think it feels like districts are probably making it a little bit difficult, a little more difficult than it has to be. We also want to remind you that this isn't just a special education thing. What we're going to cover here applies to all students, both general and special education. Okay, so the new policy says, and this is taken directly from the DESE model policy, which is located at the link that we've given you. So a little history here. Prior to July 1 of this year, your district should have already had a board adopted policy that addressed the use of seclusion and restraint. But now what the difference is that every district is required to have a written policy. So if you didn't have one before, you have to have one now. But I'm willing to bet that probably everyone listening to this training already had a policy in your district prior to July of this year. So it's the documenting and the reporting to DESI piece that's the big change. The definitions of what constitutes seclusion or restraint haven't changed. And you can find very clear definitions and examples of these two things in the DESI model policy. And I suspect that your district policy should also give, and it probably does give, very clear definitions of seclusion and restraint. Okay, so at a minimum, your district policy has to include the components mentioned on this slide. First, you must annually review the policy, and all staff must be annually trained on the policy. So don't confuse training on the policy with the actual seclusion and restraint training. They're two very different things. Your policy dictates who receives the training. Some districts train crisis teams, some districts train all staff, some districts say we don't use seclusion and restraint. So all staff has to be trained on the policy annually. So whatever your policy says you do, everyone needs to know that every year. So next, your district policy must have a debriefing component, which has to happen within 2 days of the incident. And it has to have provisions for contacting the family. And the guidance is as soon as possible, but not later than 1 hour after the end of the school day of the event. And the family has to have a written report within 5 days. So, and also I want you to note that IEPs and 504s may indicate additional specifications for notifications. And those are decisions that are made by the IEP team, and they're documented on the student's IEP or his 504. And then finally, the district has to report to DESI within 30 days of the event. We can't emphasize enough that you need to know and follow your district policy. If your district has started school, all your district staff should now be trained on the policy. Okay, and then this is just a reminder about what the DESI model policy says on who should receive training. It's all personnel that actually uses seclusion and restraint have to know the correct procedures for that. And I think most districts have, and I don't really want to say that I'm giving a shout out to any particular or specific training, but most districts have model that they use, and they have folks that are trained on that. So again, just follow your policy. Okay. So, and we have also said, so Bailey, you can go on. Okay, so who's required to follow the policy? So this is just a reminder about who has to do that, and it includes all school personnel. So not just certified people, not just folks that are trained in seclusion and restraint, but everybody has to follow the policy. So that includes your paras, your food service workers, your bus drivers, your custodians, your nurses. Basically, if the person works on the school grounds, they have to be trained on your district policy, and they have to follow the policy. It also includes your contracted providers like your OT, your PT, your SLPs. Anybody that comes into your building and provides services to your students should be made aware, know what your policy is, and they have to follow it. So for school personnel that works on programs or in programs that are not on your premises, the expectation is that they would follow the policy and procedures at the location where they're assigned. And remember that your district policy can prohibit the use of seclusion and restraint, but those are all decisions made at the district level. Okay, so now on to reporting the data, and this is really just getting to what the new is about the policy. First of all, your district needs to designate who will be the collector, the maintainer, and the reporter of the data. And in many cases, it's one person that has that responsibility. The incident reports get uploaded and reported via MOSIS, and also include a copy of the full incident report. And for students placed at private agencies, there's a shared responsibility between the private agency and the LEA. And DESI has issued a memo and posted a flow chart to facilitate in this shared responsibility. Links to this memo and flow chart are in the Q&A on seclusion and restraint, which we'll post in the next couple of days. Okay, and this is just a little picture of what the pull down menu looks like and the required fields that you collect for reporting the data. DESI has tried to make this as user-friendly and as stress-free as possible. Okay. So a little bit more about reporting the data. Here's a couple more resources to assist you. It gives you instructions about how to report single events as well as multiple incidents. And then this next slide just gives you guidance about more reporting, where to look on the pages. There's a link here to this page. And then notice the area that's circled in yellow, because it gives you, again, additional links to assist you in reporting. And then the actual events gets reported through the tiered monitoring app. So the person responsible for reporting has to contact your user manager to obtain the proper permissions. And as I mentioned before, you can report single incident or upload multiple incidents. And then finally, before we leave this topic, the information that LEAs upload about these events can be viewed by the public, and they will also become part of a compiled statewide report. The expectation is that you get this data in according to the guidelines, so within 30 days, because folks are already asking, where can I see this report? How long will it take for it to get there? So you really need to make sure that you're following the 5-day report to the parents, written report to the parents, the 30-day uploaded in DESI. And then one last thing before we leave the topic of seclusion and restraint. I mentioned before that we're going to post a Q&A that includes questions we've already received about this. You should be able to access that here within a day or two. And just remember, the main difference in the law is the requirement to document and report. Otherwise, things haven't changed very much at all. Okay, so on to IEP implementation, and these are just some quick reminders for you. Okay, so you need to be implementing your IEPs exactly as written. If that's not happening, then an amendment should be made, or it may be appropriate to reconvene your team to determine the best way forward and develop a new IEP. Also, make sure your case managers are communicating with the Gen Ed staff and providing information to them about goals and accommodations in an easy to read and understand format. In this case, your special ed case manager really is that liaison to the Gen Ed teachers. Okay, and finally, before we wrap it up here, some resources we want to share with you that are right at your fingertips. So first of all, the monthly to-do list. It's full of important timely reminders, as well as links to other information and resources. So consulting this list really helps you stay on track, especially with those things on the administrator's checklist and in the hundreds of the standards and indicators. And I just can't emphasize enough how helpful this list is. I'm a list person, and I still consult it even now that I'm retired and no longer practicing special ed director. Okay, so highlights of the 2022 August to-do list, which just came out yesterday. Some of the types of information you'll find on it are the links and information about all the updates to the sample forms, the state plan, the standards and indicators, and other changes that take effect in the new school year. The to-do list also includes reminders about annual requirements. Some of those are noted on the administrator's checklist, and it's things like your para-training requirements, remembering to update that local compliance plan, FERPA training, all those kinds of things. It also includes information about free PD opportunities for you and your staff. So there's a link to the August 2022 to-do list. Okay, Myths of the Month are another great resource for you and your staff. And on the DESI website at this link, it's located directly under the to-do list section. Here you can find the most updated information on hot topics such as observations, assessments, specific areas of eligibility like OHI and SLD, ID. Anytime there's updates, a new myth of the month comes out. And in addition to the topics you see listed, remember there's an archive there of compliance myths that you can access. And the newest myth of the month on the topic of transition and outside agencies was just posted yesterday. So you can find it there. Okay, one more resource that I want to make sure that you know is at your fingertips is our bi-monthly Zoom recordings. So if you're on this, you already know about those, but I want to make sure that you know they're all archived along with their topic resources and the Q&A documents. So you can find all of the Zooms from last year. And then of course we have a link now to the new Zooms. There's also on this page that's really helpful is a task calendar that helps keep you on track. And you can see that there are other pull down menus there right at your fingertips. So finally, I want to say this, remember to use us, your regional compliance consultants, in addition to be able to come in to do trainings in, or you'd be able to come into our centers to do trainings. We give technical assistance. We can help you with your file reviews. We love the opportunity to come into your districts and provide PD to you and your staff for that really one-on-one support. That's exactly what we're here for, and we want you to call us. So here's a list of how you can contact us. And let's see, I think Bailey, doesn't that get us to the end? Yeah. So Bailey, you're on mute. I think that concludes.
There we go. Sorry, I
Yay,
couldn't
thanks.
unmute. It said that the host wouldn't let me. Thank you, Dana. Thank you guys so much for your time. I appreciate each and every one of you. I know that this was a lot of information today. Both Lisa and I do want to just make sure you take a big, deep breath. Know that your compliance consultants are here, ready, willing, and able to help you make this 22-23 school year a great success. So thank you, thank you, thank you. And if you need us, give us a call. I'm going to put our contact information back up just in case you don't have us. Thank you.
I do want to remind everyone as we're getting ready to leave is that all the forms that updated and the changes that have been done both in the forms and the state plan, there are change charts on the forms and the state plan website. You can find all of that now. We constantly are finding things that we're fixing and updating. So just be aware, you can always check the dates on beside the form names.
Yeah, and I did see a question in the chat about, has SpedTrack been notified of these changes? DESE does work really well with SpedTrack, and so they have been notified of the changes that we have created and done. So
there are 3 vendors that reach out to me on a consistent basis, and it's SpedTrack, SIS K-12, and Lumen are the 3 that reach out to me every summer and make sure they stay in contact with me. So if it's another vendor, and also SSD, the SSD people always reach out and touch base with me. So those 4 people, those 4 entities have the updated forms. Any other kind of vendor that's out there never really reaches out to me. I know that a couple people have asked. I think Kinsey asked me if whoever she uses was there, and I think they got all the updates as well.
And I think it's the practice of those vendors to roll those changes out very quickly.
Yes, so everyone have a great day. And remember to take care of yourself and take care of those around you. We're all treading on thin ice some days.